I'm a nurse anesthetist, and I'm here to talk to you about the new safety measures needed to keep the patient's trachea safe during surgeries. These measures, or standards if you will, are one, to check the cuff pressure with the cuff manometer of the endotracheal tube with each and every intubation, and two, to use the appropriate size tube for the size of the patient's tracheal diameter. I'm going to begin with a demonstration of routine care, followed by why we need new standards for safety of the patient's trachea. So routine care is to use a size 7 for a regular size female and the injection and palpation technique to inflate the cuff of the endotracheal tube. So what you do is you use a laryngoscopy, and everything is very gentle during an intubation. And I insert a size 7 endotracheal tube into the patient's trachea. And then what I do, I take a 10 cc syringe, and so here, let's say I'll put about 8 cc's of air in. And you know what? I've been doing this a long time. I'm a genius. I know how to do this. I can feel this is the perfect pressure. Well, surgery proceeds, and 15 minutes or 15 hours later, surgery is completed. Peggy Sue is beginning to wake up, and you know what? She's got a little bit of a rough wake up. Peggy Sue's like coughing and bucking and coughing, but it's okay because I extubate and I said Peggy Sue to recovery room and everything's okay. And I can feel good because I did everything I could to keep Peggy safe during surgery, right? Whoa, let's stop. Let's go back to standard number 1. Now, if I would have used a cuff manometer the moment I intubated Peggy Sue, I would have seen that this pressure with 8 cc's of air is over 100. That's bad. What I need to do is deflate it down to between 20 and 30 centimeters of water pressure to keep Peggy Sue's trachea safe. Actually, let's go back to even the second standard that's needed, and that's I want to base my practice on research and evidence-based care. And what that says is a size 6 endotracheal tube has less complications than a size 7. So I'm going to take a size 7 out, and I'm going to use this size 6. And once again, I intubate Peggy Sue gently, insert the size 6 endotracheal tube, and let's say I'm going to put in maybe 4 cc's of air right now, 4 to 5, but what I'm going to do is immediately check with the cuff manometer. So I can see Peggy Sue's pressure is a little bit low, but I can immediately adjust it up between 20 and 30. Why is this important? Less than 20 and I put the patient at risk of aspiration pneumonia. That means liquid can go into her lungs and she could get pneumonia. We don't want that. It has to be greater than 30 or greater than 20. The reason I want it less than 30 is because there's a lot of complications associated with high pressure and large endotracheal tubes. Amongst this is postoperative sore throat, postoperative hoarseness, which is recurrent laryngeal nerve damage, and direct vocal cord damage. The most catastrophic problem, which I'm going to talk to you about, is subglottic stenosis. That is from the lack of blood supply from high pressure, leading to ischemia, leading to necrosis, leading to scar tissue, which therefore slowly and gradually narrows the patient's trachea until they can no longer breathe. What is that like? Well, shortness of breath at rest occurs at 4 to 5 millimeters. That's about the size of this straw. Imagine being a patient and breathing through this straw of every moment of every day. These people struggle just to breathe. We need to maintain safety through these safety measures. I'm going to tell you now about why in anatomy damage can occur. And we're going to look at this graph over here. Now, with an LMA, laryngeal mask airway, even that should have the cuff pressure checked, because this is an LMA right here, and that's going to sit up higher. An endotracheal tube is going to sit lower. But what you can see, the green is the recurrent laryngeal nerve that sits in the tracheoesophageal groove. The red is the blood supply. You can see how the blood supply and the recurrent laryngeal nerves are vulnerable to compression and injury, and we don't want to have any harm done to our patients during surgery. Now, talking about subglottic stenosis, what is known is that it occurs in females much more often than it occurs in men. Now, why do you think that is? One theory is hormones. Let's talk about another theory. Let's talk about cuff pressure. In this study, there were 136 women on this, or 136 patients altogether. This side is cuff pressure from 0 to 120. The bottom is endotracheal tube size from 5.5 to 8. What you can see immediately is that most of these pressures are outside of safe limits, being the green, between 20 and 30. In this study, the red dots are the women, and as you can see, the women have much higher pressures than men. And the men have lower pressures. Now, here in this one, there were 10 women with pressures greater than 100 and only 1 man. Another thing about this study, and it is a flaw of it, is that the top bar shows 120, but as a matter of fact, a standard manometer only goes to 120. So if it's buried beyond 120, is that a pressure of 200? Is that a pressure of 300? It could be 400. No one knows because it's buried beyond 120. One more reason, we have to check the pressure with the cuff manometer each and every intubation. Now, why are these pressures so high on females? We're going to scan over here and we're looking at 2 more charts. The bottom chart are tubing that depicts the size of female tracheas. As you can see, they vary from very small and going up to very large. It is not one size fits all. And if you go up to the top chart, you'll see routine practice is a size 7. A 7 is not the outer diameter. A 7 is the inner diameter. And what's so important here, depending on manufacturer, outer diameter of 9.6. Now just imagine large tube in a smaller trachea with the cuff pressure overextended, which cuts off the blood supply, and that leads to the scar tissue and subglottic stenosis. So I want to end this talk about patient safety again and the Hippocratic Oath. First of all, what we do is we pad and protect the patient's extremities with each and every surgery, and we must do that for the patient's throat too. And I want you to remember the Hippocratic Oath. First, do no harm. Check cuff pressure with each and every intubation with a cuff manometer. And 2, use the appropriate size tube for the patient's tracheal diameter. And I also want you to go to a website of Loveurtrachea, loveurtrachea.blogspot.com. That's LOVEUR trachea.blogspot.com. This has a PowerPoint presentation, it has patient testimonials, and it has research to support the need for new standards. Once again, I want you to remember, please protect and love the trachea.